everyone. I am so happy to see all of you on the call this morning and super excited to present to you a new speaker. Radhika, this is the first time joining us, sorry. And we're super excited to have you. So we will start with an introduction while we're giving mummies and daddies some time to join the call. So Radhika, you're a naturopathic doctor. So tell us a little bit about what inspired your passion to become a naturopathic doctor, and where did you train? What do you do in your clinic? What are your passion projects? What are your favorite patients? I'm hoping it's the little ones that these mummies will bring to you and so on. So tell us a little bit about yourself.
Okay, so I have a bit of a history. I had a family member who was sick, going through some cancer issues back then. I grew up in India, most part, in the south coast, the western side. It's a very small town. There's not much of things there, usually not much of a medical facility, a lot of Ayurveda, a lot of home remedies. And my family was also into homeopathics.
Nice.
And so I grew up with looking at the homeopathic remedies that were used, and we were brought up with that. Eventually, I wanted to be in a place where I could do more of the medicine, but not the real medicine, because I was not into surgery or any of that. And I found a naturopathic medicine college where they did nature cure, not really naturopathic medicine, not the Western naturopathic medicine.
Okay.
So it's a nature cure college. And they also taught yoga, hydrotherapy, acupuncture, a lot of nutrition, and it was more of an inpatient setup where you go and stay there for 15-20 days, like the old German naturopath.
Yeah.
So it was a 5-year training. I did. It was amazing, in fact. And then after that, I wanted to do further. I wanted to get into the herbs. I wanted to do homeopathics more. And so in the US, there's a doctoral degree where you have to undergo, again, 5 years of training, where you have to undergo all of these modalities and then hands-on treatment as well. So after that, I was doing my internship for a few years in the US, got my the licensing certificate, which is the rigorous exams, board exams. And then I got married, of course. That marriage happened even before that. And then we moved to Singapore. And so here I am. It's been 10 years since being here in Singapore. I'm recently with the Integrative Medical Center. Yes, in River Valley, Valley Point.
Yeah.
Yeah.
So what I know about naturopathy, I think what some moms might not know is that as a naturopathic doctor, you're so versatile. There's so many different tools that you have. Like a homeopath has homeopathy. A herbalist has herbs. A doctor only has their over-the-counter and their prescription medicines. But they don't dabble in different fields. So as a naturopath, you have so many different therapies available to you. And I think that's really important for small children as well, because they don't know pills and they don't like bitter medicine and all of that. So then you have this range of treatment options available.
Yes.
That's why I love
So the interesting part of naturopathic medicine is using the therapeutic order. So we have a therapeutic order. We start with the basic foundations first: diet, nutrition, lifestyle. And then if things are not working further, then we have more modalities. We step up the ladder, right? So then we go into working with the herbs, get into nutrient supplements, targeted nutritional supplements. And then there are antibiotics and things like that, which come further in the ladder. So as a naturopathic physician in the US, we are trained in both aspects. We have to study the medical side of it as well. Minor surgeries and all of that. Of course, we don't do that in Singapore, but as I'm talking about mainly the ladder, we have a different therapeutic order that we go into. And if there's absolute necessary, we know when to do the referrals. Absolutely. So that's why we have to have all these tools: homeopathics, the herbs, the nutrients, most of it. Yeah.
And I think the good thing is too, as a naturopathic doctor, as you say, you're trained, excuse me, you're trained in the orthodox kind of medicine as well. So you know very well what the approaches are on the other side. A GP would use, a physician would use, a pediatrician would use. You also know the side effects and you know potential interactions that these have with these traditional or conventional kind of medicines that we are prescribed.
Yes.
This is amazing to have that breadth of knowledge. So that's really great. Okay, 5 minutes have gone. We've heard your elevator speech. I'm welcoming all your mummies and all your daddies on the call. And as I always say, this is all about you. So yes, we have a presentation prepared. Yes, we know roughly what we want to talk about. But it is really about you guys or girls or moms or ladies and gents. So if you have specific questions that you want to discuss with Radhika, please raise your hand, pop some questions in the chat, and I will try and get to them as well. I'm keeping an eye as well on my phone because I might get some questions coming in as well. Radhika, please start sharing your presentation, and then we'll maybe do 1 or 2 slides, and then we'll see if there are any questions in the chat as well. Amazing. Yes, we can see it. Perfect. Oh, now you have stopped sharing now.
Well, if I...
Yeah, now we can see it again. So I think to change slides, you have to scroll up or down. Up, yeah. Because it's a PDF. Yeah. I can't hear you, Radhika. I'm not sure what's happening there. You're muted again. Let me see if I can do it for you. Hello?
Yes, I can hear you.
Yeah, now we can hear you. No, now you're muted again. I'm not sure what's happening there. Can't hear you, Radhika. Sorry. Do you want me to screen share instead?
Yeah, I think that will be better, because if I share, then it turns off my sound.
Okay, no problem.
So if you could just enlarge that image.
Yeah.
Well, let's just dive in anyways. All right, so well, before we dive into the common conditions of with the children, I would like to give a little bit of intro on why this phase is so important. Usually we know that the microbiome gets established very early at birth, right? Like once the baby is out, the microbiome starts establishing. In fact, we talk about microbiome even in utero, but the research suggests it starts in birth, and then it progresses to mature until age 3. At age 3, it turns into an adult microbiome. Okay, so the first 3 years is super crucial. What microbiome you get by age 3, it reflects the adult microbiome. Mm-hmm. And so the health of the baby will reflect the health of the child, the adult after he turns into an adulthood, right? So any changes or any dysbiosis or any interventions that are done during this phase is very crucial. Not trying to guilt trip on moms that, if you really had to do an intervention, that, don't worry about it. Of course, if that's the only choice, you have to. But just be very cautious about this phase. So let's dive in. The first thing is the reflux. So we all know about reflux. I guess mommies, you are all very familiar with the spit ups. So there is a happy spitter, and then there is the non-happy spitter. Okay. So reflux is very common. As we know, 50 to 70% of infants usually have reflux. And usually they are not a problem. It becomes a problem only if it turns into more serious issue, which is the symptoms. We'll discuss the symptoms in a little bit. So most of the infants, can you scroll down?
Yeah, and Radhika, please tell me when is a good time to ask you that mom's question about reflux as well.
Or you can interject me anytime. You can just ask me to stop and then interject me. Yes, no worries.
My 15-month-old has reflux, especially when he's going to bed. She's going to bed. I used to give her a feed 5 minutes prior to sleep, like feed her to sleep, but she woke up every hour coughing, and I have shifted to giving her the last feed 30 minutes prior to going to sleep. It still affects her, but a bit less. The question is, what makes reflux happen? How long before going to bed do the feed end? And is milk a main cause of reflux? And why?
Yeah. So reflux is very common because it's the sphincters are not very mature. The esophagus is not long enough, and then the stomach is also not really doesn't hold much. So it's pretty normal to have that reflux. Usually with make sure that they're burping well. No tummy time immediately after. At least 15-20 minutes, usually 30 minutes after the feed. And make sure you're giving very small feeds. The smaller the feed, the better. Instead of going for one breast or say both breasts for within 3 hours, you would rather switch to like 1.5 hours each breast, and then do feeding every 1.5 hours or 2 hours. I don't know if I answered your question. So try the basic home-based things first, such as burping, burping, and then changing the breast. Maybe see a lactation consultant if there is if there's a latch issue, or if there is if there's a bottle fed, then you might need to change the bottles. So there are many ways to do the home based, and then I'll discuss a little bit about the naturopathic side of things.
Okay, amazing. I'll move on here. Oh, cute.
That is the spit ups. Yes. So as you can see, a happy spitter usually have no warning signals. It tends to gain good weight. That's the important part of it. They have good weight gain. They feed well. They're not irritable, and so not necessarily any treatments required at this stage. So make sure that the upright positioning of the feet is very crucial. Smaller and more frequent feeds is what is usually advised. Hypoallergenic diet not really required unless the baby is not feeding well. So try those things. If you think that the baby is choking or is just crying, there could be many reasons. It could be a colic, it could be a reflux. So it's very difficult to just by the symptoms alone. By the end of the slides today, you probably will get some picture about what it is like.
Okay.
All right. So next slide.
Radhika, is there any particular position that the baby should be put down to sleep? Are they better off on their sides maybe, and
yes.
not on?
Yes, absolutely. So better off on the sides, no tummy, no tummy time, at least for 30 to 45 minutes. It's hard. But there are kids who don't even respond to these measures, right? So no matter what you do, they don't respond. So that's when you might need more interventions. So, all right. So you can see the normal reflux only gets problematic when it tends to have this painful cry. There's arching of the back, there's this fist clenching, or in general they just cry all day, right? And especially when it comes to feeding, when you bring the breast close to it or the bottle close to it, they just refuse to feed. So it's only when they don't feed well and they're crying all the time that's a problem. You might want to there are times when moms have a bit of an intuition that this could be GERD. So go see a physician or see a practitioner if you really feel that there is something there. And most often, again, the next slide, doing the home-based, again, burping. The next slide, please.
I've already gone to GERD. Is that where you want to be?
Yeah. So I just discussed the GERD symptoms, right? So it's usually spit ups, crying associated with feeding. One of the big red flags is unable to put them on their backs. So I had a mom who actually, she was okay. She used to cry all the day, but the only one thing that was really a big red flag was unable to put them on their backs. Okay, so throaty noises or choking, gagging. But this can also be as a result of heavy feed. Of course, the milk is coming out quickly. If there's too much milk, then it tends to gag. So just be, you don't have, can be very confusing to moms at that time. So make sure that,
So this is where it becomes.
Yeah, it can be confusing. But as I said, putting them on their backs is a big red flag. And when you put them on their back, they tend to cry. And no matter what you do, they tend to cry. So that could be a GERD issue.
So would an option here be to elevate the mattress a little bit to?
So yes, so an angle. Thanks for pointing out that. So elevating the mattress or 30-degree angle would actually help most of the time. Right?
Yeah.
And try these things. Try the burping. Try calming the baby down. So the next slide, I'm discussing more about the home-based ones. The next slide again. Yeah, so burp between each breast or a couple times during a bottle feed, as much you can, just burping. And even keeping them upright again, no tummy time, change the feeding schedule to smaller as much you can. The most important one is aggravating foods from mommy's diet is very crucial, right? So this can be again confusing as to what is causing it. It can be anything from mint to dairy to citrus to chocolates. I had one mom who was eliminating everything from her diet, but she used to have like just a little bit of a dark chocolate at the end of that evening. She wanted to have a bit of that, and that caused the reflux. So once she eliminated that, it was fine. And there was another mom who was only, everything was okay except there was mint tea. She thought the mint was helping, but in fact that caused the GERD. And mint can also, for some people, it can cause the relaxation of the sphincters, and it can aggravate GERD as well. Yeah, so potentially removing foods, dairy is a huge one. Citrus foods also from the mom's diet. Thickening the feeds, usually I wouldn't recommend that, but it's the pediatricians usually recommend thickening the feed with rice cereal. Grain, I wouldn't introduce that soon, but that's an advice that's usually given. That has to be taken, as per what your physician says, or see another lactation consultant. Yeah. So the next slide. Yeah, go ahead.
Questions in the chat now, so let's get to it now. So the one thing is related to the positioning at night. So this mom is asking, how do you maintain an upright positioning for night feeds or side-lying feeds? She means, I think, when she's breastfeeding throughout the night, where they are typically, bringing the baby to their chest while they're lying on their side. And so we could potentially elevate the whole mattress of the adults.
Yes, absolutely. The mom's angle. I know it is a little uncomfortable for the whole night, but it is what it is. And most of the time, eliminating the foods from the mom's diet just takes care of it most of the time.
Yeah. Okay. And then another question is, my infant is currently 13 days old. So this is not related to reflux now. 13 days. She does not drink. She refuses to drink anything more than 80 milliliters. How do I encourage her to feed more?
Well, in that case, you might need to see a lactation consultant and see if there is anything to do with her latch, or if there is anything else that can help. So this would be a question for the lactation consultants on this front.
Yeah. So what I would say to that, often we have babies that when they're at the 4-6 months, week mark, the amount that they will take in each feed will settle by then. And it can range anywhere between 80 milliliters and 150 milliliters. So the babies that take in one feed will just feed a little bit more. However, 13 days old is a little bit young still. So I really would also encourage you. Dr. Maithili, for example, at InMed is Radhika's colleague. She would be a really good person to see. Yeah. Breastfeeding is a really tricky thing, especially in these early days. We need to look at so many different things. Is the baby gaining weight? How are we feeding? Can we encourage a different feeding position? Can we do breast compressions? So there's so many things to analyze here that I would encourage you to take that meeting. And she takes so much time to chat to you and look at everything holistically. And then hopefully you'll get a good solution for this baby. And
Yes.
maybe it is that that's just what she takes or he takes. But maybe Dr. Maithili has a good solution for you as well to encourage them to feed a little bit more. Okay.
Yeah, so that's why, they can have a tongue tie or any of these latches that may not be, doing well. So the lactation counseling is the best option
Yeah.
to.
And it can be anything from, a slow flow and not enough
Yeah.
milk to actually there being an oversupply and a very fast letdown, and the baby struggles with that. So it's best to be assessed by a professional and then see what's really going on. Okay.
Yes. Yes.
So we'll move on to the next slide.
Well, then once you try these basic stuff, and if it's still not working, then I would do a further elimination diet with the moms, just doing it for a week or so. Okay. There are times when I would also do a food intolerance assessment for the baby and the mom together. And this is probably a topic for another day, but usually it's not an allergy test. It's
Okay.
not a sensitivity test. It's a very old method to figure out what foods the body can't digest early on. It can, so when the mom can't digest things, if it's intolerant, tends to get in the breast milk as well. Okay, the metabolic toxins, and that can also interfere with the baby's feed. And if the mom is eating things that the baby can't digest well, so that can also cause some of these symptoms. So
can I just dissect that a bit? It's not just that the baby may be reacting to something that the mom is eating, but it's that the mom is reacting to something that she's eating herself. And this reaction is being passed on in the breast milk, to just make it very basic.
Yeah, so very basic way is just the metabolic toxins. So whatever we eat, of course, the mom, it gets into the breast milk. So similarly, metabolic toxins as well get into the breast milk.
Okay.
So it's a very old, 100-year-old method that it's called Carroll method. He's a naturopathic doctor. So he devised this method, and I find this to be so interesting. And you can always start with the elimination diet first, and if it's still not working, then move further with this method. Okay.
Something new. I will ask you a little bit more about that because I'm really interested in how it works. But let's move on for now.
Yeah. Well, then again, there is not much of research talking about the foods being, an issue for the baby with reflux, but dairy is often discussed quite a bit. But as naturopaths, we talk about like all of these things can interfere with the feeding. So elemental formulas, if the bottle fed, then this will you'll have to discuss with your pediatrician. They can change it to a hydrolyzed formula where there's no dairy, but it's only amino acids. It works really well, but it smells. It smells. That's what the moms usually complain about. And yes, of course, non-soy based, because the dairy and soy, they can cross-react.
Okay.
Of course, craniosacral therapy is something which really works well. You can see a cranial osteopath. It's very calming to the nervous system as well. And also the sphincters, if it's too relaxed, they can help with the cranial osteopathy. Digestive enzymes for the breastfeeding mom, some of them can get into the breast milk and it can help the baby. And then there are herbs as well. Of course, you can see a herbalist or a naturopath for these. So you can start with elimination diet and do all of these first. And if it still doesn't, and of course you're combining it with the upright feeding as much you can. And if it still doesn't, and you feel like the baby doesn't respond to any of it, then we can do a little bit of more further interventions with herbs.
Yeah.
So
interesting to talk about now is you are clearly outlining this cascade or this ladder that you were talking about. We first look at the lifestyle, we look at the diet, we use some manual therapies. And why this is so important is that if we have a baby that is refluxy for in the first 6 months, we don't give anything but milk at that stage. I'm not sure if all moms are aware of that, but there were times when it was suggested that we could give the baby, all sorts of, teas and water and so on, but that is actually not required. But under the guidance of a naturopath or a herbalist, potentially some herbs could be suitable to be given to the baby as well. But don't do it on your own. Yeah, always consult a professional first, rather than just dabbling and trying things out. Okay.
Yeah, so there are teas, definitely. Can we move on to the next slide? So there are teas, and then there are usually the herbs in a paste. So there are different teas in this, especially if we're talking about GERD. I would usually go with this as my favorite reflux soothing paste. It has DGL, which is like licorice, slippery elm powder, quercetin, and infant probiotics. Those are my go-to for reflux. Usually takes care of it. If you look at the next slide, and just have a good cute picture on that.
Do you have a particular brand of probiotics that you recommend?
Yeah, so the first, so basically we want the bifidobacterium. Bifidobacillus is something that is prevalent in that first phase until the age 3, and it tends to drop down as we grow older. And the elderly people have less of bifido. And so the highest is in the age 3, and that's when you need that. So bifido is one. Then there's lactobacillus casei. Lactobacillus rhamnosus is another one. And then then there's reuteri as well, which I'll discuss more about that once we get into the colic section. So there are different strains of probiotics. In using a complete strain, like different strains rather than just one, is usually works. I use the Therabiotic. I like that, the Claire Labs. There's an infant probiotic that they make. It's quite nice. Then there is also custom probiotics, which I usually like, infant custom probiotics. They have quite a stronger potency and a lot of strains in it as well. So they are in powder form. You don't have to open up, but there are capsules which are really good too. Essential Biotic is another one. But you have to open up the capsules in that case.
Okay, nice.
Yeah, so yeah. So this quercetin, so 1/4, I use a 1/4 teaspoon usually for each of it. And you can mix with the breast milk or just with water, dilute it into a form of a gooey paste. The first thing you could do is to, just dab it with your pinky. If it's a little small baby, you can dab it with your pinky finger, smear it on a nipple, let the baby suck on it. Or you can also put it directly on its mouth, in the tongue. Or if it's a little bigger, you can use a baby spoon as well, 1/4 teaspoon for the baby. And that usually soothes most of the time. The cry stop. They tend to feel a lot better. Okay, yeah. And then if it still doesn't, and no matter what you do, if it still doesn't, then that will be the time to see a pediatrician. In very rare cases, usually you need to go further, like pyloric stenosis, and there are other strictures and stuff like that. There's more serious ones. If it still doesn't, the baby isn't sleeping well or not, then you might need to see a pediatrician at this point.
Amazing. I'll move on.
Yes.
Yeah.
All right. So any questions on the reflux? Of course, it's not very easy. Of course, it seems like quite easy when I talk about it. Of course, as a mom, you probably will have a lot of questions on how to do it practically. Always seeing, having people on board, like, herbalists like Johanna, naturopathic doctors, or a lactation consultant will often help you get through, figuring out what it is.
Radhika, move on. I've got questions in the chat again. So one mom is asking, should we give probiotics to infants even without reflux? So what would be situations where you say probiotics could be beneficial? Allergies, bone virus infection, or what are the indications that they might?
Yes. So most of the time, the microbiome matures on its own naturally if there's no interventions until the age of 3. So there's no harm in giving in a probiotic, even in an infant, like even a few weeks baby. There's no issues with that, and the mom can also take it. Yeah. So there's we have no contraindications of not giving a probiotic to a baby, and we have seen that giving probiotics actually help prevent allergies, asthma, and adult IBD issues. All those things. Yeah. So if there is a history of allergies in the family, I would definitely consider giving probiotics.
Sorry. Okay, so when a baby has been under antibiotic use, maybe at birth or due to infections or whatever, then helping.
Yes, that's for sure. If you have at least if they have an antibiotic exposure, then for sure, at least for 6 months of probiotics.
Amazing. Now, I've got a constipation question, but I'm going to leave this till after because I know that constipation is coming later in the slides.
Yeah.
For these biotics, should it be given to my young infant? Yeah, I think we've ordered that. We've covered that. The brands that you recommend. We had the Clear Labs, the custom probiotics, and you can get them through Radhika as well, because some of these probiotics are actually practitioner only, so they're difficult to find. So this person is asking, G6PD, would this be a contraindication to give probiotics?
No, not a contraindication.
Okay, amazing. Then we move on, and I'll make sure that I'll keep an eye on the chat again. And constipation we will cover later, okay?
All right, so colic, here we are. This is also not a new thing for moms, I believe. Well, it comes with multiple causes. A lot of things have discussed, the theories have been put out there, starting with immature gastrointestinal system. As I said, that it's maturing into an adult microbiome. So there's a lot of diversity that's going on. Because of that, there is a lot of gut inflammation in the baby's gut. Despite of what feed is given, if it's in breast milk or a bottle feed, it doesn't matter. That's what they found, that there was gut inflammation, and they measured it through calprotectin, the inflammatory marker. So because of that, they tend to have colic because the baby's organs are very sensitive. The nerves are sensitive, right? The other theory is nervous system. The baby is just integrating, sensory integration. There's a lot of that happening just coming out of the womb. And it is just a time, and it's restless. It's like a coffee baby. It's getting a lot of these interactions and sensory inputs coming in. And then, as I said, the bifidobacterium and lactobacillus were inversely related to the crying. So if you had more bifido and more lactobacillus, there is less of crying and fussiness observed in newborns. So that's why another reason for probiotics to be given to infants on birth.
Yeah. And so this is so interesting because lots of people think, probiotics is all the same, but there are so many different strains. They're down to this detail: Lactobacillus reuteri, DSM 17938. And you can actually, customize them according to what that is.
Yes, the specific one, especially this brand, do try with DSM, and the different numbers in there, okay? But the specific one has shown to reduce colic. And there is a brand on Amazon or even in Singapore, I think it's called Gerber Sooth. GERB, that has most of these strains as well. So if you are looking for something, you can also use that. But using a very good, the whole strain, as I mentioned, all of them together in one dose is good.
Amazing. Okay.
Yeah. All right, so let's move further. Again, we're back to doing the naturopathic support. Start with the diet, very crucial again. The same diet thing, the dairy is a huge factor, or some moms can notice that it could be coffee, or it can be, again, chocolate, can be anything that the mom eats. So diet is very crucial. Probiotics, again, I discussed the specific strains. Again, change the formula. Now, manual therapies, because there's nervous system involvement here, it's not just the excessive gas that the body has. It's just the nervous system. So the baby needs to be calming down. So you can always use things such as castor oil rubbing on the tummy, a bit of a pinch of, or say a drop of lavender oil with a tablespoon of like a carrier coconut oil diluted with that, and then just clockwise direction, rubbing on the abdomen with some nice words, I love you, or some music, calming music, knee to chest movements of the legs, clockwise movements. And then there is also osteopathy, right? That really takes care of it most of the time because the nervous system relaxing. There's a lot of things that osteopaths can do. Again, calming environment. If nothing works, just shifting your environment, which means take the baby out just go for a walk. I had a mom who used to say there's nothing work except changing the environment, just taking her out for a walk. That just calmed the baby instantly, right? And so when you do all of this, usually it calms down. If it's a GERD, it doesn't work, right? Okay. So you would instantly know that, okay, the GERD, the baby doesn't calm down no matter what you do.
Okay.
So that is a clear distinction between colic. But you can also have colic and GERD together. So then it becomes a bit tricky.
Wow. Mm-hmm.
So let's move forward. So calming environment is crucial. Herbs for babe. Let's look in for herbs for babe. And then also herbs for mom, because moms are usually tired at this stage. They are really fatigued. I highly recommend doing, motherwort. Motherwort. Wort means heal. It's a mother's healing herb. So it's very nourishing for the mother. They can always do teas, or you can take capsules at this stage as well for the mom. You can also do teas for the baby, lemon balm, the fennel, catnip, chamomile, ginger. There's a lot of these herbs. You can also do it in a tea, but that will take a lot of its feeding, So usually it's 5 to 10 ml, but that can take the space of the tummy. So you would rather use herbal liquids in the form of doses, like drop doses, 3 to 5 drops of this just before feed. And sometimes you can also use after the feed as well.
So it would be a very concentrated infusion that we would use in that case. And rather than filling the tummy up with because the main nutrition should be the milk.
To the milk, yes.
We give, tiny amounts. Another thing that I've learned, or that I like to recommend, is if you are formula feeding, you may as well use that infusion to make the formula up rather than, you know what I mean? Rather than just using water, use the tea.
Yes, that's an excellent thing to do. Yes. And then, the moms can always have those teas as well. And that helps most of the time.
I also want to say at this point, I have a fabulous colic oil. If anybody is interested in a massage oil, do contact me.
What do you have in there?
Leah, it's fennel, fennel, caraway seed, and chamomile.
Wow, nice.
Really nice, really amazing. Leah is asking, could we write the names of the probiotics here? I'm not going to write them in the Zoom chat because they're going to disappear, but I will write them under the video in our Facebook section, and I will post the link to the video in all the WhatsApp groups today as well. So we will see them there. I will ask you for the third. I've written down the Claire and the custom probiotics, but I'll ask you for the other one that I can't remember the name of now. Okay, moving on, Radhika.
Yeah, so one more thing I would like to add is we have seen that with colics, if you have a lot of colicky babies, it's all proposed that they can have asthma and allergies or eczema in later ages. So it's good time to intervene with all of these probiotics and doing the diet trial as well.
Yeah, great.
So Melissa, lemon balm, this is my favorite one because it works both ways. It helps to calm the nervous system, and also it tends to, expel gas. It's an excellent one, lemon balm. So using herbal glycerin, we usually use glycerin, so it's much easier for the baby. There are alcohol, there's the other ways to use alcohol-based preparations, but you can always use, ways like to evaporate the alcohol, like with warm water. I don't know if I'm confusing you guys. So the two ways of using it, let me just be clear. One is to glycerin based, and then is alcohol extracts. So to remove the alcohol, you can put a little bit of the liquid into warm water that evaporates the alcohol, and that can be given to the baby in small doses.
You could use the herb and make an infusion as well, and use in.
Yes, so it might be a little difficult to find the herb here in Singapore. Of course, maybe Johanna would have some of these herbs. Excellent. So that's, you can just make an infusion. That's excellent.
So that's the problem here in Singapore. If lots of herbs are actually available with good brands from iHerb, for example, but often they ask you to buy, a whole pound of the herb, which is a big bag, with aerial parts. So I think if you're ever stuck, just ask me, and I might be able to provide some as well. Should we move on, or do you want to talk a bit more about Melissa as well? Because so many things. I love that. It's an antibacterial.
It's an antiviral, antibacterial. It's an immune herb as well. So, but we usually do not recommend in higher doses because it is also used for Graves and hyperthyroid states. So if the baby has, hypothyroidism or whatever, so we wouldn't use it for long term.
Okay.
All right, so fennel, we talked just about that. It helps with improving the motility of the gut and expels the gas. It is also a calming herb in general. It's a carminative, but be careful about using this with GERD. Sometimes we have seen that it again relaxes the sphincters and it can increase the GERD. All right. Yeah. So that can be a little tricky sometimes. So just be careful about that, or see someone, see a herbalist. And yeah, so that's we already talked about it. So it's a wonderful carminative, and you can use it topically in oil, or you can use it orally as well.
Yeah, great.
All right, so that's, yeah. So this is, we are moving into constipation side. So if you have any questions on colic, I'll be happy to answer.
I have one on constipation. Do we want to go through this first?
Sure. So let's just do the constipation. Let's do the constipation. So what's considered normal bowel habits? 4 days to 1 month, a child can have 4 or more bowel movements each day, and they're usually liquid or extremely soft because of the breastfeed. It's more absorbable, and hence there's not much that forms, right, with the breastfeeding. So 1 to 6 months later, then that's the time when it tends to get a little infrequent. They can have as frequently as 6 times per day, or as infrequent as even once a week. And then 6 months later, on transitioning to solid foods, one can have 1 bowel per day. That's the normal. They should be easy to pass, well formed, no blood in stools, and not pellet-like. Ideally, 1 bowel movement per day. Although technically, kids can go for 2 to 3 days without defecating, and that is still normal.
Okay. So I have a question. I'll read it now. On constipation, the daughter is 3 years old, and she seems to hold in her poop.
Yes.
Not when babies when it's painful for them, they become fearful of the act itself and they stop going. The mom says her diet is good with veggies and so on, and we've tried the medical route and given laxatives, but they were not great. We then went to a naturopath and we have been given her probiotics and bitters, but she still holds it in for up to 3 days. Then we need to use a suppository. Are there any alternative options that you can see that might be helpful for that?
Yes. Okay, so the first reason why they hold is because of the anticipation of the pain. And that's because of, that's anxiety pretty much. So we need to treat the anxiety as well, in which case I would do a constitutional homeopathy. That works really well in most cases. It just helps them get rid of that fear of pooping. And then, of course, the diet has to be done well. We usually do a food intolerance assessment in this case, not an IgG, again, not the allergy test, but it helps me to figure out what food may not be digesting well. You may need to use the laxatives for a short time if required. For bitters, may not be. I wouldn't use the bitters right away because the bowels are still very, they still have the feces in there, and that can be very painful. So make sure you're using a stool softener so that it's quite soft enough. Constitutional homeopathy would be an excellent in this case if you have used everything else. The other thing is, once the bowels are eliminated, they are clear, you also need to train the musculature, because the nerves and the muscles are actually very relaxed, and so there can be more issues with that. So you might need to see a pelvic floor physio in certain cases where they have to train the bowels.
Okay. Would Rabia at InMed be a person for that? Does she treat young children like that? Or
yes, I think so. Yes, she does. And I think there is a pelvic physio downstairs we have here in Valley Point, physio down under. Amazing. So they do have physical therapists specifically for this.
Okay. And there's someone else that is really good. Daniel Barrett works more as a physiotherapist, but more on the emotional and mental, psychological aspects as well. So she would also be a good person to see.
Yes.
And I hope that answered the question for this mom. If not, please come back to us as well.
So this is exactly what I was talking about, encopresis, right? So one thing with this encopresis, you might notice that although there's fecal loading happening, the child may have a bit of loose stools that is leaking into the, you might notice that in their underwear or when they're in school. This is not because of the loose stools itself. It's because it's the fecal loading, the nerves and the muscles are so relaxed. There might be little soft stools that tends to leak out. And the sphincters, you can see there, the sphincter is not very tight enough, right?
Mhm.
So sometimes the people tend to use stool, things that can harden the stool again, thinking it might be a loose stool, maybe diarrhea. So that can worsen this issue further.
Okay.
So a good a naturopathic physician or even a pediatrician, they would examine it and see if there's fecal loading happening. And again, you can use the just laxatives or others. Like talking about laxatives now, there are different kinds. Lactulose, glycerin suppositories, yes. You can also do magnesium hydroxide, which is also excellent. Calcium, magnesium is what I use. It's a liquid form. And then, of course, do not use those high fiber rich foods in this case, because it can bulk up the stool further, right? So once the emptying happens, then you need to train the musculature, and the diet is so crucial so that it doesn't lead to more constipation. So
Mhm.
in toddlers, usually constipation begins once you start to wean off. The solid foods introduction happens. There's more simple carbs, more fruit juices rather than water.
Wow.
Yeah. So, and then a lot of dairy access, right? Excessive dairy. So all of that can build up, and that's why the stool withholding happens predominantly at the toddler phase.
Mhm.
And then moving on to the childhood, usually the constipation is because of, again, neuromuscular, functional aspect, the dietary issues. And in these ages, the childhood, they're already, the privacy is maintained in the bathroom, and the moms can usually do not check on the stooling pattern. You might notice that the child is going regularly to the bathrooms, and you assume that it's all good, the frequency is good, but the child may have just one bowel moment of very hard pellet like peace, and then the next few days would be just like a massive bowel moment.
Mhm.
And so they don't come and see a doctor or anybody because they think it's regular, but it's only when they have abdominal pain, there's blood streak in the stool, just gas, excessive gas, that's when they usually come. And that's the proportion that this is the age of population I usually see in my clinic with abdominal pain.
Wow. Okay. Moving on.
Yes. So what do we do with the constipation strategies? So this is fiber, 5 to 10 grams per day plus age. What it means to have that is, for example, if you have a 2-year-old with constipation, so you're going to increase the fiber to 7 to 12 grams per day. And what it looks like is, if you can scroll the next slide, Johanna.
Yeah.
So this is an easy way to get that amount of fiber. Of course, you can't count all those milligrams of fiber we want, but this is the simplest way to measure that. So make sure half of the plate is vegetables and fruits, and the other half is grains and healthy protein. Right. So as much you can try the vegetables. So the constipating foods, non-constipating foods. So just check your child's diet. Constipating foods are all the simple carbs, the dairy, or any of the grains. Some of the grains can also do that. And then sorry, did I say non-constipating? Constipating foods are these, and the non-constipating are the whole veggies, whole grains, veggie berries are excellent for this. Chia seeds are excellent for it. Yeah.
Want to have
So
that sort of brushes the bowels, and that's where this non-digestive,
non
fiber is really, really important. A lot of moms peel all their fruit, so I always encourage them, leave the skin on.
fiber on. Yes, definitely.
Gives the fiber, or gives more of the fiber. So if you can leave it on, that would be amazing.
Yes, excellent. And then flax seeds are often indicated, but I usually go for the chia seeds because we have seen that the chia, especially when the research has shown that the chia is actually excellent source of fiber than actually the flaxseed.
Yeah.
So chia seeds,
I would add to that, you need to make sure that they take in plenty of water
water, exactly.
as well. And chia seed, even more so, will pull out all the water from your foods.
It tends to bulk the stool even further. Yes.
Exactly. So you need to be very careful on how you take them. So for chia seed, I always say soak them first and then give them.
Yes, exactly. Yes.
Taken on a lot of fluid, then they don't are not draining it out of the bowels or out of your stools. We have some questions here. One is, infant is having constipation, how do I treat? I think we have a lot of strategies already, and we'll go into some more as well. One mom is asking, could eating rice, like porridge at infant care every day, cause constipation?
Well, it may be or may not be. Yes, if when you add grains, it tends to thicken the consistency of the stool. One thing with the moms is usually infancy, they tend to grunt, when they pass the ball. Sometimes they can grunt and it may appear like it's constipated, but that's not considered as constipation. It's just that they are trying to integrate the different components of the defecation, but unsuccessfully. So it sounds like they are constipated, but they may not be. Coming back to your question, whether adding grains causing constipation, you need to trial it out. It of course tends to thicken the consistency of the stools, and if you feel it's getting constipated and it's not happening often, then yeah, maybe instituting more fiber and more of these vegetables, purees, and fruits.
Amazing. Another question, a general one, not specific to constipation. Sorry. The other mom is asking, or dad is asking, if I'm aware that infant can eat solid food like fibers or water, even only breast. Oh, sorry. So this baby, that infant, cannot have solid foods yet. So they don't have the option of introducing fiber or water. So what can this parent do to help them go to the toilet?
Well, again, they can have very infrequent bowel movements, right? If they can have one in 10 days, which is still normal. The only thing you can do is change the diet of the mom. And as I said, I would also do the food intolerance and see if we need to do anything with the baby's diet in terms of what the mom can eat. So it has to do with the baby's with the mom's diet.
We've sometimes had success also introducing some magnesium glycinate powder, which we can put on the nipple and so on, and that might help them poo.
So the castor, yeah.
Do that if the baby is really struggling with it. If they have no issue, if they're quite happy, content, they're being their normal self, then in a breastfed infant, you don't need to don't need to intervene at that stage. They can go, as Radhika said, up to 10, even sometimes 2 weeks before they actually go. Castor oil rubbed on the tummy, a little tummy.
Yes.
Is that how you would? Yeah.
Yes, that's an excellent way. Just a little bit of in the clockwise direction, or just leave it in there for 20 minutes. It may stain your clothes, but it's an excellent way of helping the bowels to move around.
Amazing. Now back to the general question another mom sent in. So it's not specific to any conditions, but she's keen to understand if formula impacts on gut health. So, for example, if you tend to find the difference in babies' gut health between fully breastfed babies and babies who have formula included in their diet. And if that is so, do you generally suggest additional gut health support for babies that are mixed feeds or even that are completely formula fed? What is your take on that?
Well, if the baby is growing well, if it's feeding well, it's gaining weight, we don't usually substitute a lot of things other than the probiotics. So we want to see that the baby is doing well. There's no eczema, allergies as such. It's not falling sick often. There is no harm. I would just go ahead with it. Just do more probiotics in general, and that's it.
They can never hurt. So if they can do no harm, you might as well do it.
Yes.
Radhika, do you want me to move on back to that side?
I think we just go next to the hydration. So try hydration is 4 to 8 cups per day of water. Try to aim for this. Not all the time it happens, but at least 4 to 8 cups. And then again, elimination diet, dairy is a huge one. Probiotics we just discussed. Lactobacillus rhamnosus is the one that usually I recommend for this. And then herbs we just discussed the bitter herbs. Bitter herbs stimulate the motility of the gut, and they also stimulate the digestion. They help to stimulate the stomach acid, so everything else moves down easily. So there are things such as gentiana is my favorite. The ginger is a favorite one. So those are good enough. And again, we also have magnesium hydroxide and citrate, different kinds of those.
Amazing. Do you ever recommend enemas?
If there is, yes, if there is encopresis, if there is the stool withholding, and if the baby is in pain or the child is in pain, then yes, the enemas can definitely help in these cases to just get, clean up. A bowel cleanup is definitely good.
Amazing. Okay. Moving
Yeah,
on.
moving on. Yeah.
Healthy diet. Then now we're okay. Diarrhea,
So yeah, so we're almost at the end of it. Of course, there are a lot of things we can talk when it comes to abdominal pain in children, and I would love to do that, but we don't have much time. So gastroenteritis is diarrhea that's often seen with kids as they're traveling here in Singapore, in Southeast Asia. So often parents come in to ask what to do as a prevention and also for treatment. So for prevention, I usually use Saccharomyces B. This is a yeast which helps to prevent, not just prevention, but helps with the treatment as well. And you can get it here with us, or you can get it online. Homeopathics are excellent. Arsenicum is my favorite if you have food poisoning. And then there are other homeopathics as well, which, is podophyllum, and there are chamomilla. There are different kinds. So you can always take one or two of these, like arsenicum is a big one. Then there are herbs. If there is really a diarrhea, you've noticed that the baby is, the child has lost a lot of water, is dehydrated. Raspberry tea is an excellent astringent. Astringent means it helps to stop the diarrhea. Chamomile, mint, fennel, they're also very soothing. It can also, slippery elm is a big one that helps to, soothe the mucosa of the gut. Mahonia is a natural antimicrobial, and I often use that if the diarrhea is continuous for a long time, in the sense 2 days or 3 days, and usually you recommend doing Mahonia. And that usually takes care of it. Of course, other probiotics if required. And electrolytes like high sodium content foods like miso, chicken soup. You can also use an electrolyte on its own, like a Pedialyte thing for children. Coconut water is an excellent one. And then binders. Charcoal is an excellent binder. You can always, for kids, you can use it in the form of a powdered thing. You don't get the powders here. It's very difficult to get the capsules. So you'll have to pound it. It's a rather task to do.
But are tablets available here in pharmacies? I purchased them in from back home. They are available. Oh, wow.
They're available, easily available in Fair Price and any of the pharmacies. Yeah, absolutely. It's called activated charcoal. So they're big tablets though. So you just have to pound it. Yeah. And then that usually binds to things and, pushes it out of the system.
I actually love that together with slippery elm. I think it's such a good combination, and just in a little bit of warm water, and then,
Yes.
Great.
So yeah, so that's what we usually do as a quick remedy. And if it still continues, if there is a lot of dehydration, then of course see your practitioners, see a physician, and see what you can do further.
Really good. I mean, I thought there was way too much in that presentation, but it was just perfect. We are just finishing on time. So Radhika, this is really amazing that you joined us today. And I love, the reason why I invite practitioners like you onto the call is that moms and dads, they can now get a feel for what you are all about and how you treat children, what sort of modalities you have available to you. And so they will be more willing or more keen to seek your help. So I love that you could join us today. So Radhika is working at InMed, or the Integrative Medical Center in Valley Point, and that is in River Valley. Really convenient central location, a really lovely clinic where you're not going to wait for hours and hours to see someone, get your nice pucker teas while you're waiting, and so on as well. And they're really geared towards parents and small children and so on. So I love that we have you as partners, and I encourage you all to go and get help. Of course, just as a caveat as well, we shared a lot of information today with herbs, with probiotics, and so on. I do encourage you to seek the help from the professional rather than doing it DIY, because often it's a matter of seeing someone who really has a good understanding of what could potentially be happening and doing a differential diagnosis, see what's going on, and also to tell you what sort of dosages you're looking at, right? So don't just go and self-medicate, but do call the clinic and get an appointment and get that help, and then see how you can get these herbs into the child and how they can find relief. So thanks again, Radhika. It was amazing to have you on the call.
It was a pleasure.
We look forward to having you maybe on other topics, because there's a lot of things that we could talk about.
Absolutely.
So thank you so much for devoting your time to us today. It was amazing. Thank you, mummies and daddies, for joining as well. Really educational. I hope you learned a lot, and we'll see you next week on Wednesday at 10 o'clock again. Okay. Thank you, and have a lovely
Thank you.
Bye.
Thank you so much.